Good afternoon. Today I'll continue to be talking about the coronavirus and the latest updates and news. So today I want to talk about India, who on last Tuesday the government issued a stay-at-home order for almost all of its 1.3 billion Indians to stay home for 21 days in an unprecedented bid to stop the spread of the coronavirus in the country. And it currently has about 3,000 cases and 86 deaths. And currently, I think that it could very well be the next point of outbreak after the United States and Europe and China. So the first thing is that India has poor conditions that is going to encourage a respiratory disease. It is well known that the air pollution and air quality is just absolutely horrible in India. In some cases, it's even worse than China, and the humidity and it's just the air pollution is extremely serious over there, and as a result, India's air quality is just going to boost the spread of the virus. So the second thing is that India's human population isn't going to help the situation either. So studies from China suggested that people with uncontrolled hypertension and diabetes are more likely to experience severe COVID-19 and die from it. And right now, about 1/3 of India's population is hypertensive, and over 1 in 10 adults are diabetic. Children were less likely to be infected in China, but India has millions of undernourished children who need proteins and which are more prone to infections. India also has high rates of tuberculosis, pneumonia, smoking, and these won't help when it comes to the respiratory disease because these are all just going to damage the lungs before the disease even reaches it, and when the coronavirus reaches the lungs, it's just going to be devastating because the human lungs and the human immune system already being damaged by all these diseases, and this is just not going to help the problem at all. The third thing we've also seen is that India has an extremely poor health system. There is densely populated area. It's really densely populated in areas where there's basically really few hospitals, and at some there's just not a lot of doctors. And even before the outbreak, India has already known to be just horrible. And currently, India has fewer than 100,000 ICU beds and only 20,000 ventilators, most of which are only in large cities. And there's many people who are in the countryside because India is a large country. And now India has an extremely poor healthcare system. Most of its citizens are pretty poor and is extremely densely populated, so the disease and virus spreads really quickly in places where, I mean, even the streets, I think it's almost worse than China, where I've been in China, and just on a busy day, China's streets are insane with huge amount of people, and in India it's even worse than that. So it's just overall, I feel like India's main just none of its attributes are going to help stop the spread of the virus. And I feel, and since India has probably a worse healthcare system than the United States, and the United States is already suffering so much like we've seen here, then India is just going to get it worse. So there's also ways that the Indian government can try to stop the virus from climbing more than it can, because currently India's virus hasn't reached the climax. Scientists estimate it's still probably 4 to 6 weeks before the outbreak hits its peak, and so the government it's absolutely necessary to use this window of opportunity to create a more enormous, affordable, easily available testing infrastructure, intensify efforts to identify the sick and trace their contacts and isolate them, and avoid a crisis like the United States, where the United States failed to take action at a critical time and is now suffering from it. The government should also hygienic quarantine facilities and ICU beds should be set up in all state capitals all over the country, not just in large cities, which it currently has. They need to have necessary equipment, hospital beds, masks, ventilators, and also it has to train healthcare workers in infection control and safe testing. Because now, if India fails to fill these serious gaps in its capacity, many people are estimating that India is going to suffer worse than the United States, worse than Europe, and just completely take over. The virus is going to completely take over India. So that's it. Thank you for listening, and I hope you have a good evening.